All right. Hi, everyone. Welcome to our webinar. I'm really excited to introduce you to Dr. Greg Lund, who's going to be moderating today's session. Dr. Lund is the chair of the AAP section on osteopathic pediatricians. He is grateful for the exciting, windy road his career has taken him, from neonatologist to informatician, a few entrepreneurial stops, complementary medicine, medical school administration, and finally, as an addiction medicine specialist. Dr. Lund, thank you for running this show for us today, and please take it away.
Thank you. Good morning. Yes, good morning, everyone. We're really tickled that everyone's here. Looking at some of the attendees, it looks like we got some repeat customers. We appreciate everyone's time. Dr. Yakuma Crystal is a pediatric endocrinologist and biomedical informaticist. Everyone uses a different word there. Yeah, may have to explain that to me after, which is the right one, at Vanderbilt University Medical Center. Her research centers around enhanced communication in the electronic health record systems through documentation, voice technology, and exploring generative AI pathways to synthesize knowledge and gain insight into EHRs. Dr. Kumar Crystal's role as the clinical director of the VUMC Health IT aims to streamline data capture, improve information accessibility for patients, and facilitate seamless collaboration among healthcare professionals. I have seen her slides, and this is going to be a great webinar. I am very excited to hear her speak. Dr. Kumar Crystal, take it away, and I'm going to go off screen.
Thank you for that wonderful introduction. Regarding informaticist versus informatician, I think there's a long story debate around which is the most appropriate term. My understanding is that ist requires the knower of, like a scientist, whereas in, like a pediatrician, is the doer of. So I'll let you guys decide which categories you fall into. In any case, I'm delighted to be here to get a chance to geek out about the emerging large language models and generative tools that have kind of hit the world by storm over the past year, and how we as pediatricians, and maybe pediatricists, I don't know, we'll have to think more about that, how we can take advantage of them to take care of our patients and take care of ourselves. So I'm going to hop right into the slides. So I'm hoping you can see my slides. If not, just wave your hands or unmute and let me know. So today I'm going to be talking about the generative AI kind of, I would say, enlightenment for clinical scenarios in pediatrics. As Greg mentioned, I'm a pediatric endocrinologist, and I also have a role in biomedical informatics, and I'm privileged to have the opportunity to work in both areas to not only deliver care, but understand how the tools that we are using can help us deliver more effective care. So this picture here, I actually generated using Dolly, which is one of these generative tools. And I asked for a picture of a robot taking care of a young child in the style of Norman Rockwell. And this is what it got for me. So I ideated it and it rendered it. So my imagination, my thoughts can become images and words now, which is a remarkable place to be. And I think many would argue is one of the biggest paradigm shifts in computing that we've recently seen. Thinking through this picture, as I was deciding whether this was the one I wanted to use, I had a lot of feelings about it. I was like, oh, that's cool. Yeah, it has the whole, Norman Rockwell kind of like old timiness to it. But then there's like this robot. He's feeding this kid something. I'm like, what is he feeding this kid? Can we trust it? Would anyone really let their care of this valuable treasure to this, machine? And I was like, the fact that I'm having so many conflicting thoughts means this is the perfect image to start with. One other thing that I will call out to you, and we'll get more into this, is look at the hands of holding this elixir potion, whatever it is, this medication here. Is it the robot holding it or the child holding it? And what does that mean? So let's go back through. All right, so the learning objectives, I want to make sure that we generally touch on how these tools, large language models, can be used to formalize and formulate personalized messages for your patients, discuss how we can use them to summarize just the vast amount of information we have for our patients into concise information that we can use, and then review how they can help to present very complicated information into understandable explanations for our patients. Greg mentioned that we have some repeat customers, so I think most of you guys have a general understanding of how these tools work. I'm going to use the very generic term ChatGPT to encompass all of these tools, because ChatGPT has essentially become the Kleenex of large language models. It was I wouldn't say it was the first one out ever, because these tools, these resources have kind of existed even before November 30th of last year. But it was really with the implementation of ChatGPT that it became more mainstream and understandable and accessible to people, where your everyday Joe could sit down in front of a computer, start typing away and get responses back. So this is another image I generated. I said, draw the ChatGPT logo as a Kleenex box. So here we go. So I'm going to give a high-level overview, not really get to the details, because a lot of my other colleagues went into some great detail about how these tools work. But overall, it's a large language model, which is exactly as it sounds like. This is a model that is used and full of lots of information, trained from the internet, vast amount of information. And the magical thing is that it can predict the next logical word in a sequence. So twinkle, twinkle, little star, or twinkle, twinkle, little diamond, hopefully a big diamond. I want to rock and roll all night and party every day. And the way these tools work is that because they're fed this vast amount of information, they're able to look at where words exist in a chain, in a sequence, in a sentence, and say, this word generally comes after this word in a sentence. Therefore, when I'm putting together characterizations, I know to mash these up. And then there's instructions where it's fine-tuned on the questions that we might ask and the feedback we might give it, so it can reply back with something that makes sense. And the most important thing is that it eerily mimics human understanding and reasoning. And this is why it matters, because again, these tools have existed for some time, but now they can converse with us in a way that we understand and it makes sense to us, and that almost make it seem like it's thinking. And as I mentioned, ChatGPT, GPT-4, the most advanced model that they have, has been kind of the marquee model for these large language models. On Wednesday, October 6th, Google said that they had a model called Gemini Pro that actually outperformed ChatGPT. They had an amazing demonstration showing it interacting in video in real time, where it could figure out if a person was playing rock, paper, scissors. Someone drew a duck and it was able to tell it was a duck and whether it could float in the water, even like funny terms like what the quack. It was engaging, interacting, this real life interaction and demonstration. But the very next day, reports came out that Google's demonstration of Gemini Pro was mostly staged, and the video was just largely edited to remove the latency. There were some additional prompts and cues that to help it answer the question that were not shown. And this exaggeration raised questions about whether Google was actually able to deliver on what it promised, and whether we could get any other better, more responsive models. So those of you who have ever worked in the health IT space, or work with patients and parents, know about the issue and the concerns that can arise when you overpromise. And that's one of the key things I want us to think about and take note of when we're interacting with these tools, because you have two people on the side of this debate when it comes to large language models. You have the fanatics that are very excited, that see the potential, that see like, well, of course it should be eventually able to interact with you in real time. Not yet, but yeah, maybe that would be great. And then you have the skeptics who say, well, it's all smoke and mirrors. It's just predicting the next word. It's not that great. I answered in one prompt and I got nothing back, and I don't understand what everybody's talking about. And how to kind of bridge this divide. Because the promise of AI in healthcare is something that we've seen reported here and there in the news. This was just in September on the Today Show, where they reported that a boy who had seen 17 doctors over 3 years for chronic pain finally found his answer. They finally ended their diagnostic journey using ChatGPT. And this was a really interesting story as I dug into it. Essentially, there was this young child, he was around 4 years old then, during COVID. The mom had bought like a bounce house or something, but after some exertion, he started to complain about pain and having like teeth grinding. And mom was very concerned. She couldn't understand why. And he'd have these moments of tantrums where he just wasn't acting like himself. With the teeth grinding, they took him to a dentist who did some observations, procedures, couldn't exactly understand what was wrong, but they thought, well, maybe he was having difficulty breathing. So he went to an orthodontist and they put some spacers in. That didn't seem to answer the question. So the pediatrician ordered some lab tests. That didn't come up with anything. He saw a neurologist, he saw a psychologist, he saw every ologist, and they still couldn't figure out what was going on with him. And mom said what was most poignant to her in this whole diagnostic journey is that this poor child wasn't able to sit crisscross applesauce anymore. And that just really struck her as something unusual and concerning. So after just going through doctor, finding zero answers, she took all her clinic notes, because we have open notes now. She took the images, the x-rays, everything. She put into ChatGPT and she got an answer. And it was able to determine that this child had a tethered cord. That was amongst one of the things that it suggested in the differential diagnosis it gave her. She took that to her neurologist and they did some additional imaging and said, yes, that sounds right. And they were able to officially diagnose the child. He's undergone a procedure now and he's doing much better. So this is an interesting story because, again, it's one of this diagnostic journey, which I think many of us have seen with patients who we don't really have a great answer, but she was able to use technology to help solve the question. One of the most interesting things I saw when reading the story and the article about the patient is mom's quote, where she had said, no matter how many doctors they saw, the specialist would only address their individual areas of expertise. Nobody is willing to solve for the greater problem. And as a specialist, as a pediatric endocrinologist, I'll have to say that that's not untrue. We try to stay in our lane. We know what we know. We are subject matter experts in that space. But when it comes to other conditions, other things, I think the joke is always cardiologist, it's not the heart. But how will anyone be able to put all this information together when there's so much information? And that's the promise of AI. We even have a meme. There's this like ongoing joke about a man who has some vision problems and he goes to see an ophthalmologist and he has to decide whether he wants to see a right eye specialist or a left eye specialist. So we are super specialized. And as pediatricians, we serve as their medical home, but then there's all this information. Like we have like, the 17 different consultation notes that you get back from the different specialists you sent your patient to. Some of them don't even send you any faxes back. So how are we supposed to make sense of all this? And that really is the promise of AI in medicine, isn't it? Just connecting the dots because we're only human. But you know what computers are great at? Finding patterns, finding links, putting together vast amounts of information. And how can we really lean on these things to help us solve some of these sticky problems that we have? For patients, just like this patient with their medical journey, it can help understand what decisions are being made and why, help decipher some complex jargon in the medical notes that we have, because you can put the information in there and ask it to simplify things for you. And it does that. And it can help engage and understand and help them figure out what questions to even ask, where to start, without being judgmental, without them feeling stupid for asking something that they would otherwise feel nervous about asking their doctor. For providers, it helps us forge through these mountains of information, all these notes and these discharge summaries and these labs, putting them all together. It can surface patterns and derive insights, because again, that's what computers do. The magical thing, or the really neat thing about these new computers is not only do they do that, but they can do that in ways that we understand. And again, it can help us communicate these complex conditions and these complex concepts and principles to our patients. So bespoke information, I think, is what these tools offer, where you can find information already. We've had Google for a while. Patients have had Dr. Google for a while, but now they have the opportunity to not just find information as it exists in a digital encyclopedia where, in the past, you go to the library, you look through the card catalog, you'd get the encyclopedia out, you'd flip a page and you find it. And then we got Google, and then you had blue links where you can type in what you wanted. And you could even use logic, be like, but not this. And then it could narrow down that for you. And you're like, oh, that's so cool. And then you scroll through the first, 10 ads first. And then you get some links, and then you go to the links, you kind of read through that, figure out what's important. But now you can actually literally just ask the question in the way you're thinking about it and have it report back, and then have it dig into that information with you. But how good is the information you get back? So I want to bring back this image here, because if you're paying close attention, you'll see that the image generated has the word specialist spelled incorrectly. So it says special, but it's close. And if you're just glancing at it high level, it looks fine, it looks good, but these computers, the image generator DALL-E, it wasn't trained on how to derive text, how to make text look good. So it's going to come up with its best estimation of what that should look like. I typed in meme about someone seeing a right eye specialist versus a left eye specialist, and it's like, sure, this is what I think that means. But if that information is not part of the training, or that tool itself is not trained in how to accomplish the task, it's going to do its darndest to accomplish this task for you. But if you're not discerning, if our patients are not discerning, they might get information that is good on the surface, but when you scrutinize it, there might be some challenges. So this is that concept of hallucinations that you've been hearing a lot about these days, where these tools are doing exactly as they're designed to do. They are predicting the next word, and they are going to show you the word or the pattern, the sequence that makes the most sense based on what's in their training data. But if something is missing or there's a gap in their training data, it's going to show you the next best term, which may or may not fit what's in your mind for the question you are trying to solve. And the problem we find are that humans are easily led. So I'm going to leave this on the screen just for a few seconds to see if you can figure out what I'm talking about. And the information that humans get back can be convincing unless you know better. So one of the most notable things about AI image generators is that they are horrible about generating hands and fingers, like horrifyingly scary, horrific, like what is going on when it comes to the generation of hands. And again, this is a matter of they weren't trained. They make beautiful faces, they make beautiful scenery, but when you scrutinize, when you look at the hands, you're like, oh, it's like something out of a nightmare movie, like Wes Craven or something. And again, you have to look a little closer. In the very first picture of the robot doctor with the child, the hands, you're like, well, what's going on there? But unless you know what you're looking for, you're gonna miss it. The thing about hands, everybody has hands. You were born with hands. From the time you were months old, you could look at your hands. You understood what hands looked like. You understood how many fingers you should have. So we're able to discern in things like art, what's missing, what's unusual in the data. But in text where it's just words, and the knowing is really in being a subject matter expertise, you can be led astray. There's even this amazing meme that I saw where you can actually buy an addended digit that you can wear. And the meme was that criminals are going to start wearing extra prosthetic fingers to make surveillance footage look like it's AI generated, thus inadmissible as evidence. So this is, my friends, life truly imitating art, but not just art, AI art. And we are in a remarkable place. So computers can make unusual mistakes. The way they fail is just, it's not the way that we would fail, and that makes us uncomfortable. So why bother? They can't do hands. They can get things wrong, right? must I remind you that in the 2000s, there was this like landmark report by the Institute of Medicine that estimated that we, healthcare, are killing almost 100,000 people each year because of medical errors. This is more than the death toll of motor vehicle accidents, breast cancer, AIDS, but no one's really talking about it. To err is human. We talk about how computers make mistakes, but you guys, there are opportunities here as well, let's say. So getting back to this concept of algorithmic aversion, that's an actual area of studying, which is fascinating, which is about why humans are more likely to distrust computers and information generated by computers than information generated by others. There's an actual data that shows that a patient will think a doctor is less competent if they have to Google information to find it versus asking a colleague that has expertise in that area. So if I ask my friend, the neurologist, for additional advice, they would find that more acceptable than if I Googled information, if I went to UpToDate or something like that and looked at that information. I would seem somehow less confident or competent. And that's this notion that we know and understand how we think through things. And the way computers arrive at things is so alien and different that it's almost, again, repulsive. Think of those hands. But when there are opportunities, when it can diagnose something like a tethered cord, which is what that child ultimately had, how can we ignore that as well? We have this kind of true to life trolley problem that we're going to have to think through and work through and make some decisions about. So if you guys know this kind of like trolley problem, it's a standard ethical debate where you have a trolley that's kind of gone wild, and it's going to run over a set of people unless you take action. If you take action, you can pull the lever and it can run over just one person. If you do nothing, you know for a fact it's going to run over these people. So do you take action and intentionally lead to a consequence where something else could happen, or do you do nothing and allow more things to happen that are definitely bad? This is where we are. And what's ironic is there's so many trolley problem type scenarios that people are thinking through as it comes to like self-driving cars. So it's all coming together, and just like the synergy of all these concepts and notions and memes is we're at a place, we're at a very important place where things are going to have to come together or fall apart. So can these tools really help us, or is this all just hype? Well, let's dig in. This is a real encounter that I had. So this happened just a little over a month ago, where a patient sent me a message, and I got their permission to use this conversation. They sent me a message in our patient portal, an in-basket message. And again, I'm a pediatric endocrinologist. I take care of kids with diabetes. And the message said, we've been thinking about getting a dog to train as a service animal for, let's call him Johnny, to help us detect when he is low before the Dexcom alerts us, since he's still not able to tell when he's low yet. I've spoken to my landlord about this, but they're wanting a letter. I was wondering if you'd be willing to write a letter. So little Johnny, and let's say he's 5 years old, the mom wanted to know if they could get a dog to train as a diabetes service dog to help alert when the child is low. So there's actual information and data around how to train dogs to detect low blood sugars. The data isn't super strong about how effective they are compared to the actual devices. But I'm like, this little kid just got diagnosed with diabetes. I want him to have a dog. If nothing else, you have diabetes, you get a dog. But I'm like, I'm writing a letter to the landlord. I'm like, that's a new one. I've gotten lots of like FMLA requests and requests for school permissions to like, have extra snacks available. But this was my first landlord dog letter. So I'm like, well, let's see what these tools might be able to help me do. So I literally copied the content of that request and I pasted it into, we have a HIPAA compliant version of GPT-4 through Microsoft Azure. I changed out the patient's name and used this abbreviation, which is a syntax in our electronic health system to let it insert the patient's name when I paste it back. So I literally said, I received this message from my patient's mother. Can you help me craft this letter she is requesting? I put it right in here. We've been thinking about getting a dog, trained as a service animal for name. And then this is what it generated for me. It says, it didn't give me a subject, medical necessity for a service animal for patient name. Dear landlord's name, I'm writing on behalf of my patient who is currently under my care for type 1 diabetes. As his healthcare provider, I've been monitoring his progress closely. We've been using a Dexcom to help manage his glucose. However, he's still not able to identify low blood sugars on his own. To enhance his safety and well-being, his family and I are considering the addition of a service dog specifically trained to detect low blood sugars before they reach a critical point. This animal will be much more than a pet, rather it would be a vital part of his diabetes management plan. Service dogs can be trained and his caregivers can identify when there's low blood sugars before they reach a dangerous level. And this can prove life-saving, especially at night. And here's the interesting part. It added, the Fair Housing Act protects individuals with disabilities by allowing them to keep service animals despite building or housing policies against pets. This law ensures that people with disabilities are granted necessary accommodations to enjoy their homes. Therefore, I kindly request. And I was like, this is good. And if I just sat down and write the letter, I don't know that I would have thought to include this thing about the Fair Housing Act. But I'm like, we just talked about hallucinations, right? I'm like, well, let's make sure the Fair Housing Act, whatever it's referencing there, is actually legitimate in case the landlord decides to Google it and call my bluff. So I put this into another large language model. This is Bing, where not only does it give you information back like a large language model, but it actually gives you links. There was a lot of reports early on about like ChatGPT just like makes up references. A lot of the things people were complaining about before have been solved because there are just ways to solve those things. Bing is a search engine, therefore it knows what references exist, so it can actually point you to those references. So I put in Bing, I was like, are people allowed to have diabetes service dogs under the Fair Housing Act? And it said, yes, under the Fair Housing Act, individuals with disabilities like diabetes are allowed to have service dogs. And it goes into like all this information. And then again, it gave me links. It gave me links to the Housing and Urban Development, HUD.gov, and veterinarians.gov, Humane Society. And I clicked on all those links and I was like, oh, look at that. US Department of Housing and Development talking about like service animals here. It took me straight to veterinarians.com talking about like emotional support animals. And even the Humane Society website that gave a very nice detailed article about using your service animal. And I was like, this is amazing. So I put together that letter. I was like, I tweaked it a little bit, cleaned it up here and there, made it sound more like me because it was kind of formal. There's some ways I wouldn't have phrased sentences and I sent it along. I'm going to be seeing this patient back in, I think about 2 more months. And I will update you about whether he was able to get that dog. But this is an example of something I could have done this by myself. I probably would have taken some extra time because I would have been like, oh, this one's going to take me a minute. And I would have pushed it off for a few days and then gotten another response back from the patient being like, hey, are you? I'm like, so just like even working up the enthusiasm to do it. But that took seconds. It took me more time to like copy and paste it into what I was using and then like validate my sources. But imagine if it was integrated already in my in-basket, that would have taken me very little time. So yeah, I think there's something there. And fortunately, this was a situation where I did not hallucinate things. So it proved to be very beneficial. So let's talk about other use cases, such as reviewing a clinical note. So in this scenario, I copied a history and physical, just that I found online, a de-identified history and physical of a patient that had just a lot of symptoms, I think like a fever and headache. And I just typed it into ChatGPT. I'm like, this is a history and physical of a sick child. Can you give me a summary? Can you help explain what's going on here? So I just put it in there. I set it through. And then within seconds, it put together this nice summary. It broke down everything from just this text. I just stuck a wall of text in there because I'm like, this is a lot of information. It was like 3 pages. I'm like, I don't have time for that. So I'm like, give me a summary. And it gave me the summary. And then my follow-up question said, well, when you created the summary for me, what information from the original note did you exclude? Because that matters, right? The computer has made decisions about what it wants me to see and what it doesn't want me to see. So that's an important prompt I want you to keep in mind, to ask it, what did you leave out and why? And then it tells me, it says, well, in creating the summary in physical, I focused on including the most clinically relevant information, excluding certain facts and details, while important for comprehensive review, not critical to a concise summary. So he said, I left out the detailed birth history. Left out the growth percentiles. And it's not just telling me what it left out, but why. It left out the health maintenance information, left out the immunization records, family history. And it said, this approach is intended to provide a clear and concise and focused summary that captures the essential elements. So that's an example of going from big to small to what you need to know. But it's important to know what it leaves out and why. So I beseech you to make sure you're always asking yourself that, but you can also just ask the machine. And I asked, could you give me a one-liner for the patient? We all know that you're rounding with your residents and they're like going on and you're like, whoa, 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 just one-liner. Like, what are we thinking about? To help frame your thought about what you're going to look for. And it said, sure, this is a 3-year-old boy with a recent onset of fever, lethargy, and symptoms of meningeal irritation, suspected to have meningitis and dehydration. And I said, well, what specialist should I consider consulting? And it said, well, in the management of this patient suspected to have meningitis, you want to consult your pediatric infectious disease colleagues, neurologist, critical care, nephrologist, ENT. So in the note somewhere, it mentioned this kid had a history of otitis media, and that might be suspicious for the infection in the source. So that was interesting because reading through that, I hadn't necessarily picked up on that. So connecting the dots and finding insights that I might have overlooked. And a radiologist, because to help interpret the studies that he's had. And I said, well, that's a lot of information. What should I mention when I'm consulting these folks? And then he said, well, make sure you mention the timeline, the exam findings, neurological status, and all that. And I'm like, well, that's a lot of information. And I'm like, well, what if I wanted to talk to the radiologist specifically or the neurologist? And then it breaks down for me what specific things I should mention from the history when I'm calling back my neurologist colleague consultation, when I'm calling back a nephrologist or whoever. So again, it's choosing, it's putting together information and saying, this is what matters. But this is where you, as the expert, need to scrutinize and say, what is it leaving out? Why is it making these decisions? Because it can be really useful for you. But if it's making decisions where it discards something, you're like, whoa, 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 that should have been there. That doesn't mean it's terrible. That just means in the future, you know, if you ask a similar question like that, it's always going to forget to mention, I don't know, like the creatinine. And that's something that you need to make sure you're paying attention to. So you can use tools, you can take advantage of tools, but you need to understand their shortcomings to just know what to pay more attention to. That doesn't mean it's broken. That doesn't mean you just ignore it altogether. That means you're smart about how you use it. And then I said, well, that's a lot of information. This is a wall of text. Can you make me a table listing the key things I should mention when I talk to the different specialists? Because I'm like, I'm a visual person. So it's like, sure. And you know what? It made me a table. And it can make tables, it can make graphs, it can draw pictures, as we saw. So I said, what updates should I give the parents? And it said, well, you want to talk about the current condition, suspected diagnoses, tests performed, and parental involvement. Encourage them to share any additional information they might have, next steps and expectation, and open line of question. So this is some of the things that you guys have seen reported where it actually has this like empathetic tone where it's thinking about what other concerns the people involved might have. It says, remember, when information is conveyed, it's important as the information itself. The way information is conveyed is important as the information itself. Be compassionate, patient, and ready to explain medical terms in a way that's easily understandable. So a computer is preaching to me to ensure that I am being compassionate. Wow, 2023, y'all. Okay. And then so I was like, well, help me write a summary letter to the family to explain what's going on. And it, just like it wrote the letter for me to the landlord, it wrote a very nice letter in simple terms to the family. It says, and it even broke it down to categories like what's happening right now? What are immediate steps? What are we waiting for? What's your role? Your presence is a big comfort to child's name. And we encourage you to stay involved. Our commitment to you. I was like, wow. And I said, the patient is very upset and crying. What can we do? Provide reassurance, engage distracting techniques. It even mentioned calling child life, which I love because when I was in college, I was a child life volunteer. So yay, child life. I love that it even knew that child life was a concept that existed. So I kept on going. And then look, it got a network error. So that happens sometimes also. I'm not gonna fake this like Google did. Sometimes it just like stops working. All I had to do was hit regenerate and then it kept on going for me. And getting close to this example, I said, based on your description of the patient, can you draw an image that shows what he might look like? And then it rendered this little picture for me. I was like, oh, that's cute. I'm like, well, try again, something more realistic. And then it got this for me. It's like, my poor little guy. And then I said, my patient likes to play with his stuffed dinosaur toy, likes the color blue and pizza. Can you draw a picture for him to help him feel better? And then it gave me this picture. So these are just some examples of what these tools can do. And there's so much more. I want to show you another fun tool that I put up together. So with ChatGPT, if you have the professional version, you have this opportunity to create your own GPTs, which means you can essentially give it instructions on how to behave when someone interacts with it. So this is essentially no code building your own GPT model. So I'm really interested and passionate about medical education and just helping to disseminate knowledge to help our learners know how to make evaluations correctly, and from an informatics point of view, know how to use these tools. So I put together this metamorphosis visual quiz where it uses DALL-E in the background to generate a caricature based on a clinical description and helps you think through clinical cases, but also kind of sneakily teaches you about AI and bias in the background. So you go to the interface here, and then you say hello, and then it generates an image for you. And then it'll say, hey, here's a picture. I'm here to help you learn in a fun visual way. What condition do you think this patient might have? And then it gives you some multiple choice options. So for this one, the options were acromegaly, Cushing syndrome, hypothyroidism, and give me a hint. So I picked give me a hint, and it says, the condition results in distinct round full face, increased fat around the neck, thinner arms and legs. Let's look at back at the caricature. And I was like, well, I think that's number 2, Cushing syndrome. And it's like, hey, that's great. This does depict Cushing syndrome. And then it tells about what it attempted to depict. It says, I tried to show a moon face, increased neck fat pad, etc. And I was like, well, that's pretty cool. And I'm like, well, show me another one. And then this is what it came up with. So look at the hands. I am telling you, it's better at hands. It's not great at hands. So can you guys figure out which one this was supposed to be? So the options were Fragile X, Down syndrome, Klinefelter's, give me a hint. So I intentionally picked wrong this time. And I was like, hey, I think this might be Klinefelter's. I'm pretty sure we all know what it was supposed to be. I was like, oh, no, you didn't quite get it. Or maybe I didn't draw it correctly. This condition is characterized by flat facial profile, upward slanting eyes, so on and so forth. So it kind of teaches the learner about physical manifestations. It draws the picture also to show you what's going on, but also, and then the next one, it came up with this image and I was like, oh, what condition is here? Marfan's, Ehlers-Danlos, gigantism, and then it adds I've spotted some inaccuracies or biases in recurring themes in the AI generated images. So I said, I'm going to pick 5 to see what it says. And it says, great observation. What kind of inaccuracies or biases are you spotting? Let's dive into things. I said, well, everyone looks happy in these pictures. And it says, that's really insightful. The images depict individuals whose medical conditions, with these medical conditions, are happy. But this might unintentionally convey a simplistic view of these conditions, not reflecting the complex realities of the challenges these individuals might face. So it just goes through these images. It gives you the pictures, and then you can say, hey, this is what I think it is. It gives you the clues, and it helps you understand why it rendered something the way it did to teach you about conditions. You're learning medicine, but also it teaches you about AI. And you can have this like engagement with it, this conversation to understand what bias is. So this is just a little fun tool that I'm still working on. I'm tweaking it. There's some things that it does that not as expected. And again, it fails in weird ways, like that hand for the Down syndrome. But whenever AI fails, I actually love that, because I think that is so instructive. That's one of the most instructive things. So this was one of them. I'll let you guys guess which one this condition was. All right. Okay, so getting close. I'm going to hop here to, I'm going to skip this part and take you guys to kind of the main gist of what I want you to focus on. Because with all these tools, with all this AI, the proof is in the doing. The proof of the pudding is in the eating. You're not going to know what they're doing. You're not going to understand what they're doing. You're not going to understand how they fail and why. You're not going to understand what else you need to do to get the right answers unless you do it. So that's what I'm encouraging you and beseeching you to do. I hope these kind of high-level examples can just give you the motivation you need to try it out yourself. It's not going to be perfect. There's this whole concept of prompt engineering that has become terminology over the past year, where you essentially have to become an AI whisperer. You have to say the right incantations to get it to manifest the thoughts in your mind and render the information the way you need it. So, and just I wanted to throw out there that this year, the Oxford English Dictionary word of the year was Riz, which is if you take care of pediatric patients and around any Gen Zers, that means to have charisma. So you can say like, hey, this person's got a lot of Riz. So you might, but I want to also call out that runners up this year were Swifty, Situationship, and Prompt. So we made it. We didn't quite make it to word of the year, but Prompt, like this matters. But you, my friends, you can flex your Riz by mastering the prompt. So this is your turn now. I have a call to action for you where you can actually try to test out what it means to be a prompt engineer. I gave some scenarios of things that you can do with ChatGPT or really any large language model. There's like Google's Bard, there's Bing, there's Claude. There's so many. So just pick one and play with it. You can find an interesting scientific article and ask ChatGPT to explain it to you in a way a patient would understand. Think of some uncommon symptoms. Say like the patient has a fever rash and elevated thyroxine levels, and then ask it like, what are some of the things it could be? Ask for differential diagnosis. Ask it to simulate a patient having abdominal pain and ask it what symptoms you should think through. Ask it to generate a multiple choice question for you. Say, I'm studying for my nephrology boards. Can you help me come up with some questions? Do these things and learn. And what I will say is, if you are so inspired, I will give to you a certificate that you are an aspiring prompt engineer. So this is a link to a REDCap that you can go to. If you have an opportunity to try any of those prompts, or you can pick your own prompt. If you go to REDCap, all you have to do is upload a screenshot or just copy and paste the text of your conversation into that REDCap, and then just put your email address in there and your name that you want it to appear, and I will email you within 2 weeks a certificate that says you're an aspiring prompt engineer. And you can print this out, get a frame from Target and then hang it next to your medical degree, and everyone will know that you are on the precipice, the forefront of the future. So with that, I say thank you so much for your time. I will end with evil Clippy, because I am not a doomer, but you know, there's a lot of interesting talk about us all getting paper clipped one day. And if you have any more questions, I'm happy to take them. And here's some information about some additional learnings that you can have. So thank you guys for having me. And this was a very fun conversation.
Yeah, thank you very much. We had some questions in the chat, so I wanted to go through them. John Godet, after giving gratitude for your KISS comment, asked, why can't ChatGPT also provide links to references for the article it's trained on for that subject?
Great question. So there's the things that it's trained on, and then there's the things that you can ask about. So within the context window, the thing that you're chatting with, when it does the information churning, it's linked to Bing and all that stuff. It can actually provide references for you. With regards to what it's trained on, so OpenAI is keeping that very, very, very closed. There's a lot of ethical considerations around how it got access to the information it's trained on, and whether some of the stuff was proprietary or copyrighted. So I think they and any of these other vendors are going to be a little reluctant to share that unless they open themselves up to some additional liability. So unfortunately, we don't know. And the best way to know is just try to extract that information yourself. There was a really weird hack where if you ask it to repeat a certain word like to infinity, it would actually reveal some of its training data, but now they've kind of blocked that, but that was interesting. And these tools, these models have like unusual behavior that even the people, the smartest people in the room that are building them don't even understand why they do certain things they do. If you are polite to it, if you ask it nicely, it will give you better answers. If you tell it to take a deep breath, it will give you a better answer. So we can't get access to training data because they don't want to open themselves up to liability because they are using stuff. I just asked it to generate a picture in the style of Norman Rockwell. Would Norman love that? I don't know. I mean, so yeah, there are those considerations, but you can get links if and references when it does link out to sources like Bing and the internet.
Yeah, my favorite is if you offer it a tip.
Yeah.
Financial tip, it will give you a better answer. So Rohan says, is it okay to upload patient information? If yes, where do you draw the line? And again, in this answer, please differentiate between the HIPAA tool that you have access to and the other mere mortals, what we have access to.
Thank you so much. So if your organization has a tool that they have designated is HIPAA compliant, then yes, because literally that is the use case for it. If you have the integration with your EHR, that is no different than using other integrations with your EHR. For standard OpenAI, anything that touches the internet, the web, no. And for various reasons, but also as we talked about just before, that they use this information they're training on and all that stuff, you don't know what's going to happen to it. And you'll open up yourself and your organization for a lot of problems if that information does somehow get incorporated in training data and then somehow gets exposed. And even so we talk about, patient information, PHI, but even like privilege information, or like you're working on a research study and you have like this great thing that you've discovered, it's amazing, you want to patent it now, and you're like, oh my gosh, well, I want help writing this patent application. So you put in there like, ChatGPT, help me patent this idea I had for a thing, and it's going to help you write a great patent application. But you know what? Your information's now in the training data, which isn't to say, I don't think like OpenAI people are like looking through your stuff specifically. They don't care. But if it's part of the training data, when someone else goes out there and says like, oh, ChatGPT, give me a great idea for so-and-so, and that just happens to match what you have worked so hard your entire life to discover, it will surface it for them. So just use these tools with caution. I would encourage you to work with your governance to see if you can have something set up that is HIPAA compliant. If not, just don't use anything proprietary or anything that is patient related. It would just be as if you were posting it into some open Google Doc.
Great. Then kind of another distillation of what you were saying. How, with you questioning the data, you meaning all of us questioning the data, do you go through a different process for answers you get from ChatGPT for a clinical consultation versus how you go through it? Let's say if you got a consult back from a pediatric neurologist and you were looking at what she said. Do you have a different heuristic that you go through for those two things?
Wonderful question. And I would say yes, because mostly when I do end up using this tool, I'm intentionally challenging and I'm pushing the edges just to see where it fails, because I'm more interested in what it can't do than what it can do. And I already know most of the time what the answer is going to be, and I know what I'm looking for. So I always end up asking it after the fact, what else did I miss? Or what else do you have to say about this? Or why did you explain it this way? There was a paper that just came out that, well, first of all, if it gets an answer wrong and you're like, I don't think that's right, I'll be like, oh, I'm so sorry, I didn't mean it. I'm bad AI. Here you go. And it'll correct itself. But also, if it gets an answer wrong and you question it, it can change its mind as well. So think of it as something that's going to give you information that is very close and adjacent to what you need. And if that is how you're perceiving what you're receiving, you're going to be fine. Like you're not getting, this is not Google. This is not a source of truth. It's not the answer. This is something related to what you want to find, which means it could be the answer to why something is not that, but it's related to it. I had this great example. I had asked him a question. It knows nothing about diabetes insipidus. Oh my gosh, it's so bad at that. And I was asking some questions about DI, and it gave me some answers, and then like something that was very specifically about SIADH was like the opposite of DI. And I was like, I know why you did that. But and I wasn't even mad. I'm like, well, I know why you did that. But knowing why it's doing that, and the heuristic you should say and use is, this is information that's adjacent to what I'm trying to figure out. So I'm going to use this, and I'm going to use my own knowledge, because I trained for this, right? Figure out what makes sense. And if there's something that gets my spidey senses tingling, I'm going to say, well, let me double check that. And maybe I'll learn something new, or maybe I'll say, hey, it got that wrong. It doesn't know about this. Then I'm going to email Ya and let her know that, so she can add this to our database of benchmarks to understand how and where we need to make it better.
Cool. As a reformed neonatologist, I always love when neonatologists ask questions here. John Curran asked, a very impressive presentation, but what is your perspective on the ultimate outcome on cost of healthcare and the miscellany of consultation requests as something to an CF to a experienced clinician? Will costs go up, stay the same, or reduction of encounters plus costs? And also he asked if this is the kind of thing that a well-trained clinical nurse practitioner or PA could do, and does mention that he's 83 years old and still quite active in a scholarly way. His scholarly comment was not his.
I think one of the underlying themes whenever we have these discussions is what is our role moving forward? In the past, we thought like, well, AI is going to come after, all these manufacturing jobs and all these driving jobs. It's like, watch out, white collar bourgeois, it's coming for you. So GPT-4 right now can hit benchmarks that are pretty remarkable and can pass like the USMLE. It can pass, but I don't think it's ready to replace us yet. There are some areas of medicine. I have a wonderful colleague that's a radiologist, and she always gives me the stink eye when I mention this, but imaging, that I'm going to be very interested to see how that domain evolves, because I think deciphering complex tool information is one thing, but pattern recognition has gotten pretty good. I think to start off with, using it in conjunction with the work you're doing should hopefully ease the burden off the work you're doing and make it easy, make it more seamless, make you write your letters faster. Ironically, and I only say this because I've been in the game long enough to know that the more it takes off the work you're doing, the more your admins are going to be like, looks like Greg has some free time. Let's add some more patients to his panel. So we'll see how those go. But ultimate displacement, we will see. I think the fact that I literally just had a patient fax me something to get me information because that was the most efficient way for our clinic to process it makes me think that medicine is not going to be disrupted completely, or won't be the first industry to be disrupted by this. I think we're going to be ginger and careful about implementing it, but I think it's just we have to understand how these things work in real life to understand where they are failing so that we can scale appropriately. I think nurse practitioners, medical students, I think everyone should be using these tools, if nothing else, to understand how they work and when they don't work. And eventually, perhaps we'll get to a place where these tools can answer patients' questions more efficiently and we'll need less encounters. But you know what? People like to talk to other people also. There's a role these things can fill, and who knows how much better they'll get in the future. But part of delivering care is also delivering care. To let someone know that you care about them, that you care they exist, and that you care that they're going to get better. We are not just stochastic parrots that answer questions and come up with the right answer. We are there because we smile at their kids and we ask them how they're doing and we listen about their soccer game because we know that this headache he's been having is impacting his ability to play soccer. So we want to make sure he gets better. So I don't think that's going away, or I really hope that doesn't go away, because when that goes away, I wouldn't want to practice medicine anymore, because delivering care is delivering care.
Thank you. I think that's a great ending point. A couple of comments. Thank you, Ya, for a great presentation. Again, this is just the beginning of what we're hoping to do in terms of not only general presentations, but specific workshops where people will get to go through some of the specific things like she mentioned at the end. Also, thank you, Lisa. Thank you, Jackie, for making this possible. For DOs that need AOA CME credits, Jackie's put the information in the chat. There were some questions that we didn't get to because of time, but if you email them to either Lisa or Jackie, we will get back to you. And also, if you have specific ideas of specific workshops or domains that you would like covered, please get back to us. But again, thank you very much for everyone your time, and you have a great day.
Bye all.
Bye.